some reason, I don't see where I can. All right, where did it go? There we go.
Okay, so unmute. Okay.
You ready?
Yeah.
Yeah. Good morning, everybody. Thanks so much for joining us. I hope everybody who's listening and watching and all who you love and live near or work with are safe and well. And for those of you who are dealing with a loss of someone or someone who is suffering, please know that our greater support, our greater community of support is here for you. We're going through this incredible time all together, and we have a big tent here at NIAPRS in the mental health community, and there's room for everybody to get support. And we really want to be there for everybody. This is quite a time. I'm Harvey Rosenthal. I'm the CEO of the New York Association of Psychiatric Rehabilitation Services, and on behalf of our staff and our board, I want to welcome you to the second of 3 consecutive Tuesday morning virtual free executive seminar sessions. For those of you who may not know NIAPRS, we've been around since 1981, and we have served as a change agent. Our intention has been to be a change agent in our field, in the way services are delivered, in the way we're understood, people in recovery and services, to raise the bar for what's expected and possible for people in recovery, and to raise the bar for what's expected for and from our providers and our policy officials. So we're very focused on improving services, public policies, social conditions for people with a variety of mental health, substance use, and trauma-related challenges. Our focus is on health and wellness and recovery, community inclusion, so all may achieve maximum potential in communities of choice. We have a very unique coalition that we bring together, people in recovery who receive services, people in recovery who provide services, and people who provide services without any affiliation. Although we believe everybody is on the continuum. I just want to, that was meant to be a joke. So anyway, we're here to implement this great mission of ours. NIAPRS, the way we incorporate and act out our mission is through state and national policy. So most recently, we've been very active with other groups on pushing for safety and PPE and social distancing in prisons, jails, hospitals, adult homes, nursing homes, etc. We've been involved in trying to get more funding for the states and for the providers. We do a lot of state and national training in TA, and we've gone entirely virtual, both here in New York and nationally. We have been involved in peer innovations, having created the Peer Bridger program, and we're in an all-hands-on-deck mode in all of the 5 state facilities that we work at. We've spoken with Amanda about this, and we're really sort of gathering a plan and working with the facilities. And I'll give you one very quick example. I'm going to talk probably too long this morning, but we have a Bridger down in Binghamton, talk about all hands on deck, who makes her own sanitizer and her own masks, very intricate, safe masks. And with the people in the community that she works with, she's very careful, scrubs the seats, wears the masks, whatever. This is a person who generally has been unengaged, been in and out of jail and hospital, but she's got him engaged now, and she took him fishing the other day, all with all the safety and precautions. So it's nice to know there's some kind of normality that can happen in the midst of this, in this climate, for people who need it most. So anyway, that's something we're very proud of, and you'll be hearing more about. Our work has never been, has never been needed more at a time like this. So we've been really rolling out a series of services for people at this time, that's relative to the virus. Some weeks ago, we had a seminar with Kristen Woodlock on tips of working virtually in the field. She launched with us the Strive for 5 campaign, which is to reach out to 5 people every day for a month. That's a campaign that's picking up in Ohio. The state of Ohio adopted it. on their website, and the commissioner came out and spoke about it. It's also being picked up in Scotland and parts of New York, for sure. Thanks to Ruth, we have a daily meditation every morning to kind of give people that kind of grounding and comfort and hope for the day. I put out, a series of daily postings pretty much every day to kind of keep people informed about the environment and opportunities. And also, Len did a series of webinars in the last few weeks on COVID funding that was available. For example, the Paycheck Protection Program, which is now restarted, I understand. But that's COVID funding for providers and beneficiaries. All of those are on the website, www.niapers.org. All of them are recorded, and the PowerPoints are there as well. So over the last 16 years, our seminar has been aimed at really helping to shape the direction of policy. We've tried to be a little bit ahead of our time and really looking for the future and trying to set the table for innovations that really raise the bar for people in recovery and the system that we work in. This year's seminar, we had to go virtual, as you know, and we did it at no charge. We really want to be there for our community, and so we had all our presenters sort of be willing to do this, and we're coming to you live from Greenwich, New York, in my living room. But you'll see where all of us are coming from in a short while. But the seminars had to go virtual, and this is a great sort of production, thanks to Eileen, who you hear in the background, is our office manager, and Len, and our statewide training experts, and our consultant, Edie Schwartz. So this has been a program long in coming and hard work on. Last week, we had a terrific and timely discussions. We have about 450 people. We already have them registered now, maybe a little bit more, excuse me. And we talked about how 4 of our most seasoned and accomplished agency leaders have viewed and carried out their exemplary leadership. We heard from Peggy Swarbrick, the nation's expert on 8 dimensions of wellness and wellness techniques during this time. And we heard from Donna McSilver on strategies to attract, support, and retain a high-quality workforce. I tell you this because you can also, on the website, be able to download them and the PowerPoint. So anything we're doing is going to be available if you're not able to make the original. Next week's program, we're going to feature an expert plenary and follow-up presentation by Drew Giovanni on culture change, organizational culture change. We'll have a very special event with Pat Deegan, the pioneer, one of the great pioneers of our recovery movement, who will trace the recovery movement and the work that she's done in particular, I've asked her to talk about. And then she'll be talking about the interface now between the recovery movement and recovery approaches and the medical models and managed care models. And it'll be fascinating. She'll be with Jim Gavin and Lisa Dixon, and I'm looking forward to that in particular. There'll also be a very timely presentation on building a trauma responsive organization. Very timely right now. Certainly as the virus begins to abate, and we hope that soon, there'll be so much work for us on trauma, grief, bereavement counseling, all forms of mutual support. So it'll be good to hear from Eve about that. Today's program is intended to really look at inspiring examples and stories of how our state and community is helping to address the fear, the isolation, the trauma, and the loss that many of us are experiencing. And in this program, we'll look at strong policy responses. We'll hear from the Commissioner and Ann Sullivan and the Special Assistant to Commissioner Amanda Sake. We'll hear about dedicated leadership and team efforts from providers throughout the state, peer providers and providers in general. We'll hear about innovative models of services. And all of them, hopefully, are going to offer you a mix of hope, and collaboration, connection, and comfort during this time, because that's what we want to offer to our entire community. Today's program, I'm almost done, you'll be happy to know, will feature the Commissioner, Ann Sullivan. We're so delighted to have you, Ann, with us today. And also, we're so delighted to have Amanda Sake, our Special Assistant to the Commissioner. And they'll each perhaps say more about themselves as the other speakers will throughout. We have 3 inspiring community agency leaders you'll be meeting them, Robin Kruger and Dana Lang and Barry Brogan from different parts of the state. They have some very inspiring stories to tell about how we're sort of coping on the ground level in the midst of the virus. And then we'll hear eventually a panel of exciting, cutting edge peer crisis innovations. And we have 4 presentations that are, again, really diverse and really well done, very clear, some good data, some good examples and some good stories. And then we'll also have an expert presentation on successful value propositions from our favorite consultant. I'm sorry, Edie Schwartz, but Kristen Woodlock is our favorite consultant. We want to make her available. We're lucky to do that. So I'll be back in a minute or two, but I want to introduce our COO, Len Statham.
Thank you, Harvey. I am very happy to be here this morning, and apparently so are you, because as Harvey said, we had about 440 last week, and we have more than that this week. So we are proud that we're able to offer this executive seminar for free and online. I just want to go over some logistics for today. For those of you that are looking for CEUs, you're going to receive a link that has an evaluation form attached to it. Please complete it within 24 hours of the end of the day 2 of the seminar. And every person actually is going to get that link. So if you want to, we encourage you to actually complete it, even though you don't want the CEU credits, because we always want to know ways that we can improve. And during the session, you'll only see the presenters on the camera. If for some reason you find yourself on screen, we'd ask that you turn your camera off, and that's relatively easy to do. In your picture, you'll have a blue box that you can go up to in the right-hand corner and just stop video. Highly unlikely you're going to find yourself on the screen, but if you do, we'd appreciate you doing that. And also, Eileen, our office manager, has muted everyone, so you shouldn't have a problem in terms of, we shouldn't have a problem hearing you or background noise. Please use the chat box for questions that you have, and we have our own Ruth Malone Wagner taking those questions. And even if we don't get to all the questions, we had a ton of questions last week. We'll make sure that those questions are answered and sent out to everybody. Now, at the conclusion of the plenary, which is at 10:30, you will be asked to leave the room that you're currently in. And so in order to go to the next room, the workshop rooms, because we have breakout rooms, you need to take the time right now to go to www.nyaprs.org, our homepage, and I believe Ruth has put that in the chat box already. And on the left-hand bottom of the screen, you'll see some information on the executive seminar. And that information includes day 2, April 28th. You'll click onto that, which will give you the program and the workshops. And under each of the workshops, there's a link. So during the break, you'll go to that the front of our web page. If you have it up, you can keep it up, and just click on the room that you want to go into, and you will automatically go back into that room. And then finally, at 12, when we all sort of come back together, the folks in Peer Crisis Innovations will stay in that room. And then the other workshop will go into the Peer Crisis Innovation room at noon, so that we can all hear some final thoughts and final remarks from Harvey. I just want to say on behalf of NIAPRS, welcome everyone, and I hope you have a great morning. Thanks so much. Bye-bye.
Thank you, Len, for all your help here. So I'm really delighted. This program is really, there's a lot of thought that really went into the program, and we're so delighted that Commissioner Ann Sullivan and Special Assistant Amanda Sake are able to join us. The focus here, and we kind of developed these on the fly, we thought, you know, this would be a really important time in this sequence to really look at what is the New York response to COVID at every level. We see so much incredible sort of leadership from the governor. I've just really not seen anything like this. I'm so proud of what he's doing and so glad for the progress we're able to make, however slow. So certainly at his level, at the commissioner's level, and down through, down through the facilities out into the community, we really want to sort of get a look at, take a ride around the block around what is the New York response, what is government doing, and what are we doing as advocates and as providers and as peer supporters, people in recovery. What are we all doing to contribute to make this New York response as effective and humane and powerful and far-reaching as possible? So to start that out, I'm going to introduce the commissioner. She will talk, and Amanda, I believe, you're both coming on, I believe, for 20 to 30 minutes or so. And then our people on the ground, we have Tayana Lang from Brooklyn. She'll tell you more about herself. We have Barry Brogan from the North Country and Robin Kruger from Western New York. Really fabulous people and presenters, and they'll introduce themselves after the commissioner and Amanda have spoken, and they'll make a presentation about what they're doing out there. And again, the goal is to really explore what are the policies, what are the stories, and hopefully we will have some time for questions before we end. So I'm going to turn over to the commissioner.
Hi, hello. Good morning, everyone. I just wanted to, first of all, today, to really have the opportunity to thank you all virtually for your commitment, your caring, and your dedication during this very, very challenging time. I've been in this business for over 40 years, and I would never have thought of the challenges that we faced over the past 60 days and or the response from the community, from the healthcare community, from all of you, from all the providers, which has been so extraordinary. So I'm with you in learning new things and moving forward at a time that's extremely challenging. I'd also like to just say that I've been very blessed that myself and my family are healthy and safe. But I also know that there are many of us out there, including some friends that I know who have suffered and who have been lost to COVID. And there's no words to express that. But I would really just like to be able to say to all of you that I know all of us being here together and working together can help us get through it. I'd also like to just thank Harvey for doing this and for all you've done, Harvey, throughout this time. It's been amazing, the work that you've done to support the community, your advocacy, and also just the information that you've gotten out there in such a timely way at a time when it's just so important. And your strive to connect to 5 is terrific. That's a wonderful challenge. It's gotten a lot of attention. And I just think, as always, you're one of the first to action, not just to talk about things, but to actually do something and to be active in terms of helping support people through this crisis. Harvey's asked me to talk a bit about what the government response has been. And so I'd like to talk in kind of maybe 3 places about that. One is just the overall government and agency response. 2 has been how we've been working with community providers. And then 3 would be a really look forward as to what we might be doing for the general public and for all New Yorkers as we continue through this crisis, and hopefully as we begin to emerge from it and deal with what has been the sequelae of all the trauma that people have experienced. So first of all, what the government has been doing, and I hope some of you have had the opportunity to look at the governor's briefings every day. I think that he has really done a tremendous job in pulling a team together that's first priority is to really keep New Yorkers safe and healthy and to get us through this crisis. If you listen to what he's been talking about, a lot of the initial response across the state was to the immediacy of helping individuals who are sick and ill with COVID-19. And living in New York and being based in New York, I had the experience firsthand of working with the hospitals here. And during that peak of the surge when we had tremendously crowded emergency rooms and the need for ventilators and the need for volunteer staff who came from all over the country to work in our hospitals. The State Office of Mental Health had to respond too. And so we had to be able to take some more clients into our facilities over that period of time. And it was very important because I spoke with leaders of the hospital systems across the city, and they truly needed to use some of the beds which were traditionally there for our patients to really be able to use those beds for COVID-19. And so some of our psych units in the city were closed or temporarily closed, and we had to make room, and for clients who still needed to be in the hospital, but we also had to work with those hospitals very intensely at their inpatient and their discharge plans and with their ERs to get people safely into the community if that was at all possible. And I think that we had to be a part of that phenomenon, partly because it was just critical in those early days during that acute surge that some major hospitals needed those beds. So for example, in the Health and Hospitals Corporation and in certain hospitals in Queens, it was very important that we work with them very closely to enable them to convert some traditional psychiatric beds to COVID beds. Similarly, in the state system, our primary responsibility was to keep our patients and the staff safe. It was difficult in the beginning because COVID had gotten into our hospital systems, much like it got into the community. And so we had to do a lot of work on infection control and working with staff and working with patients to be able to keep people as safe as possible. It was a challenge. I think just like the challenge across the city and now across the state. But I think we've been overall successful overall in keeping people safe and healthy. It has been difficult on staff, I have to say, because some of our staff also became ill and had to stay home or weren't as available. So those were things we had to juggle over those, particularly during that period of the surge. And a lot of the effort of the state was focused on that. And the reason they were focused on it so importantly was because people were ill. And I know that we also had to focus on areas in the community, et cetera, which I will get to in a while. And I can't thank enough the Office of Mental Health staff who are truly remarkable. Our staff came in day after day to the hospitals to work. They were there for our clients. They were there for each other. And many of them, as soon as if they did become ill, as soon as they were better, were back at work and wanting to be there. So I can't thank the OMH staff enough for what they have done, and also for the support that we got from everyone in the community. So that was a big piece of the initial work that was done, was really managing. And if you listen to the governor's reports, there were lots of discussions about protective equipment. There were lots of discussions about ventilators. There's lots of discussions about where beds were, about opening up the Javits Center, et cetera. We're over that hump now in a way. Personal protective equipment is much more available. We have very much been able to, in many ways, move forward from that tremendous surge that was there. But now we are facing still a very serious virus, which we are still in, on pause in the city. Probably that will last a while longer. There may be some areas of the state that will open up, but the importance of still using masks, still social distancing is so critical, because this virus is a killer, and it's very, very infectious. And even as we begin to come out of this period, I think we all have to really listen to what people are saying about being super careful for ourselves and for our families and for our communities, to continue to wash our hands and do everything that we have been doing to move forward, and hopefully to be able to continue, as the governor said so often, to contain the virus. Now to talk a little bit about some of the things that I think in the community were pretty remarkable. And one of them has been this massive expansion of the use of telehealth. And I hope some of you have had that experience, something like this virtual experience that we're having right now. But we've found that many individuals who have used telehealth, have used phone calls or video conferencing or telemedicine, have really liked it, have been able to communicate well with their doctors, with their therapists, with the people that they work with. And it's been very successful, just like this virtual meeting is. And I think that we also, as the state, very early on, made any telecommunication, for example, for Medicaid, to be totally reimbursable at the same rate as face-to-face. That was really critical for our providers, so that they would be able to financially stay afloat and be able to know that they could successfully bill for the kinds of services they were providing via telephone or telehealth. And it's really very exciting. And I think in the future, one of the things that may come out of this terribly challenging and very sad time is how to better use technology and how to be more effective. And I think we're learning that. And I hope we don't lose those lessons as we go forward. So certainly the expansion of telehealth and telemedicine in New York and across the country. And hopefully we can get payers and others to kind of be part of this. There's still a lot of need for face-to-face contact. There's a lot of need for that in-person personal connection. But I think we could be doing more in telehealth and telemedicine, and that's something that we will be looking at. The other critical things that we did with the community were constant kind of, we had multiple webinars, multiple guidance that went out in terms of infection control and how to work and still see clients still work within the parameters of being safe in this environment. And I know there were struggles with that in the beginning. I think we have learned a lot and we've gotten much better. And at this point in time, I think we have really been able to even distribute to the community some personal protective equipment from the state to enable people to feel safer in terms of the work that they're doing. But that kind of precaution is going to continue, and it's not something, again, I just want to keep emphasizing, this is far from over, and we really have to continue to work at that. The other thing I just want to mention from the community is the payroll protection plan. I say this every time I talk to people because, you know, there's a lot of talk about getting federal dollars into the state. We all know that the state budget is in very serious trouble since the coronavirus. But the payroll protection plan is something for people, employees less than 500, who can actually get dollars now to help them over this period of time. So if you have not, I'm just giving a little commercial, if you have not applied, please do so. Please find out how to do it and do it because you can, and that money is actually flowing. It is money that people are actually getting. So that's an important community message, and we've been a part of trying to get those messages out to everyone as well. We have calls weekly with community providers, and we've been out there talking. We've been out there providing guidance, providing seminar, webinars, etc. So I think that that's been another big piece of our job, is working with you and helping to troubleshoot, so that we get lots of calls, and we hope we have been helpful in terms of helping individuals and community who need, community providers who need our assistance. And then lastly, I'd like to just mention a little bit about what the future I think is going to hold as we move forward from this experience. And you know, those of us who were around after 9/11 know that the pain and the trauma of 9/11 lasted a long time after the event, and that this virus is going to linger. It might actually have some impact come back again for a certain period of time, we don't know. So the reality is that we need to be very, very careful about what we're doing into the future, but we also need to provide support on an ongoing basis. So one of the things we set up, which we've been very successful with, is the Emotional Helpline, which will continue. The Emotional Helpline has gotten over 10,000 calls over the past few weeks. And we've gotten calls from everyone. You know, we had a call from a teenager who didn't want to worry his mom about his concerns about school and, you know, friends, etc. We've had calls from spouses who were concerned about their spouse being a frontline worker, but didn't want to talk to them about it because they didn't want to worry them. So they would call us and talk about their concerns and their fears. Isolated individuals, some people who felt that they didn't have anyone to talk to. And then a lot of people calling about anxiety and needing some help with how to deal with that anxiety. So we did a lot of quick work on mindfulness and meditation and just taking some time to deep breathing exercises, etc. Some people have called back more than once and to talk, but almost everyone, when I've talked to people who've done the calls, has felt that they've gained something. And these calls last somewhere about 15, 20 minutes. So they're not short interactions. They're actually interactions that are very, really can give people something that they need at this point in time. And then going forward, we have applied for a whole host of grants from FEMA and SAMHSA to provide crisis counseling services and services into the future. Because we know that some people will feel the effects of this after it's kind of calmed down or over. Others will feel it during, but we need to be there for the public at large, as well as all the individuals who are in our system of care. So we're going to be working on that. That's something that, while we're still in the middle of this, still have to be thinking to some extent about the future and where we'll be going and what steps we can take to make sure that we have those services available. So I will stop there, but just to say one more time how proud I am to be in the state at this point in time, and to be a part of the team that includes all of you, who is working so hard and so caring within our communities. And now I'm going to turn it over to Amanda Sake, who is our Director for the Office of Community Affairs at OMH. Amanda?
And I'm wondering, and excuse me, Amanda, I'm wondering if I can just make a comment and a question to you, Ann. The comment is, first of all, your agency is putting out so many very helpful pieces of information, including the latest piece that the COVID, the PPP monies are back online. You got that out right away. So I just want to thank you for all the information and transparency that you're putting out. And I guess I have two questions quickly. One of them is, we talked a lot about virtual, people relying on their phones. A lot of our people have limited either monies, phones, or minutes on their phones. And this is just a thought. Maybe you don't have to have an answer now, but it seems to me a major issue is, how do we get more phones to people, or how do we extend the minutes? And could even at the governor's level, get the Verizons of the world to lift the minutes so people can get this urgent help for months to come? So just a thought. I don't know if you have any reactions to that.
No, I think it's very important, Harvey, and we'll be working on that. I mean, I don't know, we'll try to work with the Verizons, as you say, of the world, but I think we have to figure out a way to make sure that people have access. That is, you know, that's not that costly a phenomenon, to tell you the truth. And it's more, I think we have to figure out how to just make it happen, because people, it's a critical access point of the old-fashioned telephone. And I think that that's something in the minutes that we should be able to make happen. So yes, we're going to work on it, and hopefully we'll be successful in making sure that everybody has that access. You're absolutely right. Right.
And can we get that 800 number again, please? Because we're hearing a lot of really good sort of comments on the chat box.
The helpline?
Yeah, the helpline. I'm sorry.
Yeah. You know, I should have it memorized by now, but I don't. So let me find it while Amanda talks, and then I'll give you the help number again.
In the chat box. No problem. Amanda, I'm sorry. Thank you, Commissioner, very much.
Thank you. Harvey.
Your information, and Amanda, welcome. Thanks for coming on.
Thank you. Thank you. Good morning. I'm very grateful to have this opportunity to speak with you all this morning. Thanks to Harvey and his team for bringing us together in this virtual seminar. This crisis has changed everything. The mood of the country and the state is filled with anxiety, fear, depression, and despair, and many New Yorkers are struggling. The uncertainty and the strain of it all can be quite paralyzing. For many of us living with mental health issues, a lot of what the nation is struggling with now is not new to us. We've been there personally many times before. These experiences have had a profound impact on our lives and can define how we face adversity. For me personally, I think about my own recovery and how I've been training for this moment for most of my adult life. I'm confident that many people receiving behavioral health services may feel similarly. I think there is an opportunity to remind ourselves that recovery is real and possible for all. Sometimes it feels like people within our field see our value, the value of peers, for our lived experience with mental illness and the ability for folks to connect to that aspect of our lives. We also have to remember that peer practitioners' lived experience of resiliency and recovery is something that people can really connect to, and that expertise can and should be utilized for navigating this current challenge and beyond. As many of you know, the hallmark of recovery-oriented services is hope. Sometimes when an individual is struggling, hope is the hardest thing to connect to. As recovery-oriented practitioners, we often need to hold the hope for the individual, reminding them through our words and our actions that recovery is possible and attainable for them. We talk about how we can identify and capitalize on an individual's strengths and skills to overcome the barriers that they experience as a result of the mental health issues, institutionalization, the impact of stigma, etc. And we talk about the resilience and our ability to bounce back from setbacks. We talk about how meaningful life roles, purpose, community inclusion, and relationships are critical components of what helps a person become successful in their respective recovery journey. I believe that we can choose to view this situation that we find ourselves and our behavioral health system in from two perspectives, a deficit-based perspective and a recovery-oriented perspective. A deficit-based perspective might suggest that there are serious problems to triage and treat so that our system can return to its baseline of functioning. A deficit-based perspective might identify the end of the game as getting back to normal. What's valued from this perspective is stability, compliance, and the avoidance of relapse and setbacks. Now, there's nothing inherently wrong with this approach per se, but it can be limiting at times, particularly when we're trying to focus on systems change and evolution. A recovery-oriented perspective would also recognize that there are serious problems to address and that the triage and treatment might be good first steps to get us back on track. A recovery-oriented perspective would suggest that there is hope for recovery of our system, and the strengths and assets of our system will help take us in a direction that gets us closer to our goal to supporting the resiliency and recovery of all persons served. A recovery-oriented perspective would prioritize that holding the hope for others who might not be able to see it just yet for themselves and the system. From my vantage point and from the vantage point of the Office of Mental Health, we've certainly seen the struggles and adversity that our system is facing. We've also seen strengths emerge that I know will help guide us through this crisis and help us to continue to evolve in a truly recovery-oriented system of care. And here are some examples. One of the strengths that we've seen is creativity. For example, genuine peer-run agencies and services pivoted so quickly to creative strategies to ensure their services were available and they remained engaged with their folks. Almost overnight, everything became accessible all over the phone and through digital platforms. Support groups and wellness activities continued using out-of-the-box strategies, including online cooking classes, exercise classes like Zoom, Zumba. I imagine we all did Zumba right now. Museum tours, and no-cost hobbies using items at home are amongst only a few of the things I've seen offered all over the state. I've seen and we've seen extraordinary efforts taken to engage individuals during this time. As Harvey and as we talked about, unfortunately, not everyone has access to reliable cell service or technology to stay connected. But this hasn't stopped our workforce from trying to connect with people. I've heard of countless workers writing cards and letters to those they serve to help stay connected. There was one behavioral health employee in New York City in a community-based agency who wrote letters to an individual to help them obtain a cell phone. Now, they still send letters with notes of encouragement, tips for engaging in telehealth and accessing other additional resources, in addition to their now newfound ability to talk to each other over the phone. Another example of creativity comes from one of our state-operated facilities downstate. They developed individualized comfort kits for individuals who are either quarantined or spending time in isolation. These comfort kits contain books, puzzles, art supplies, magazines, etc. The individuals also had an opportunity for one-to-one time with a rehab practitioner to call or FaceTime loved ones and other support. They were also provided with cards and notes from other facility staff and fellow residents. One program in Buffalo conducted a digital group to bring together individuals to teach each other how to sew masks. One of the individuals with exceptional sewing abilities made personalized masks with flair to give to their peers. And this kind of reminds me of the story that Harvey shared earlier. Finally, training providers have adapted quickly to provide support to the workforce. NIAPRIS, for example, has developed training specifically geared towards considerations from working from home and supervising from home, which I was very grateful to hear that they were thinking about that. Other providers are thinking about how we can support our workforce as we move toward more services provided digitally. One of the things that my office has been doing in collaboration with the Academy Peer Service and a group from Dartmouth is to bring more training and resources for the provision of digital peer support. These are just a few examples of creative strategies to help us maintain engagement. I hope that the strength of creativity will sustain us through this crisis, as well as guide us to grow as a system when we're on the other side of this. As leaders of organizations, it's critical to support this creativity that resides in the workforce and the individuals served by your agencies. The second strength I've seen is traditionally siloed programs and individuals coming together to provide robust support systems. In one of our facilities in the Hudson River region, there was a need to quickly consolidate staff to support individuals in quarantine. Staff from the inpatient rehab department needed to work closely with staff from a residential program. They used their combined areas of expertise to raise the bar on what they offered to their folks. The rehab staff were able to help the individuals prepare for telehealth appointments and access pastoral care over the phone or digitally, which was a service that the residential staff didn't know existed. The residential staff were able to connect the inpatient staff to more community resources that they were previously unaware of. From a systems level, I saw Shaku's comment earlier. There's also now, if not at any point, the need for collaboration across systems. Yesterday, I had a really good conversation with my counterpart at Oasis, and we talked about how, you know, there's no reason why we should be siloed, and we are stronger together. So I'm looking forward to continuing that dialogue and reaching across other systems to make sure we're maximizing the most of what we do, and we're sharing resources, and we're helping each other out. Internally within OMH, we formed a morale committee comprised of representatives from parts of the agency that normally don't interact on a daily basis. As we work together on ideas and projects to support our workforce, we've learned a lot from each other. I personally learned a lot about my agency and colleagues through these crisis response efforts, things I would have probably learned eventually over time, but I feel I can more effectively do my job as a result of these new partnerships. I think there are a lot of opportunities for us to continue to come together as service providers, and this is another consideration for leadership. There are a lot of resources and talents within your own organization that people might not have access to. So consider prioritizing cross-program communication and collaboration to ensure you're maximizing the impact of the efforts of your staff. Finally, and as Anne mentioned earlier, I think there are a lot of opportunities within telehealth efforts that can maximize engagement. While I can't currently provide you with statistics, I can provide you with anecdotes I've heard from the community. One community provider in New York City wrote to us to say that they were very grateful to have the telehealth option, and have reported higher treatment engagement and observations that people were progressing in telehealth therapy more quickly than they did with face-to-face treatment. I've heard from people receiving services in Long Island and Central New York that they felt more comfortable in the telesessions because they felt more able to open up over the phone. Others have struggled with telehealth and missed the face-to-face interaction. That's to be expected. I know I miss seeing folks in person, and I know the value and comfort that comes from those in-person interactions. Another anecdote that I learned just this morning during the leadership support group, a provider down in Long Island shared that the use of teleconnections for their residents has increased the opportunity for their residents to speak with supports and relatives that they haven't talked to in a long time. When we had to think about our visitation policies to make sure that our staff and residents remain safe, we had to think of creative ways to engage folks. So it was very encouraging to hear that people were utilizing FaceTime, video, teleconferencing, anything they could to help their folks stay connected. And I think we can take away from this crisis that perhaps a hybrid approach to service provision, utilizing telehealth opportunities, will increase our engagement efforts with individuals and hopefully yield more positive outcomes. I know there are countless stories of creativity, collaboration, and engagement out there in our state emerging from this crisis. I encourage everyone to continue to view the situation and our work from the recovery-oriented perspective and hold the hope for those who might be struggling to connect to it. I know I'll be trying my best to, and I hope you'll join me. Thank you.
Thank you, Amanda. That was really wonderful and very hopeful and positive. I have a question for you that came in from the chat box. Can you talk about engaging and including youth and young adults, especially regarding their perspectives on telehealth and how to make that work for everyone, especially considering the disparities that exist in access to technology, but mainly on youth and young adults? Any thoughts about?
So this is a great thing for us to follow up on. And the example I just provided was from a facility that served youth, and the residents, when they were no longer to have the frequency of visitation that they used to have, they really had to think outside the box. with engaging with technology. And again, they found across the board that the youth within the program with the FaceTime option were connecting to relatives that they hadn't seen or spoke to in years. So the increase of access and any fears or kind of anxiety about the technology, the practitioners were there with them side by side. But I think that further inquiry to youth and young adults in telehealth is an important thing for us to look into, and I certainly will.
Thank you. And I'm not alone in saying how many grateful people are for your work, for what you're doing in this position, and the leadership, and just, you know, what you see today. You're very personal sort of a conviction and commitment to this. We're really glad you're here.
Thank you.
Okay, we now are able to bring on our speakers. So I guess I'm going to ask Robin Kruger to open up her camera.
Good morning.
Robin Kruger is the CEO of Community Missions in Niagara Falls. It was one of the just really most devoted, long-time devoted organizations. We've known them a long time. We've known Robin a long time within NIAPRS, but the work you'll hear about knows no bounds around the virus or this environment. They've been serving all these years on all levels, all populations, and they're doing that now. And Robin's doing a really great job of leading that, and she'll tell you more about that now.
Good morning, everyone. Quickly, as Harvey described, Community Missions is a unique blend of services here in Niagara Falls and in Niagara County. We have OMH license programs, food pantry, soup kitchen, emergency shelter. We also have apartment treatment, supported housing, and community residences. We have recovery services such as PROS, peer recovery respite center, transportation for SPMI adults, and then we have a children's CR and juvenile justice programming for youth and their families. And we partner with certainly many of the organizations, OMH, DSS, DCJS, and many others. We've been in Niagara Falls for 95 years. I've been with Community Missions for 43 years, and 25 of those as the CEO here. Harvey gave us a list of questions to go through and sort of think about to kind of help you understand sort of the western end of the state. We are the true upstate. When you think of New York City, you think upstate as Westchester, but when we hear upstate, we think of Rochester and Niagara Falls and Buffalo. So we went remote March 18th, and then most of the agency followed, and we were all working a combination of being in office and remote. Our administrative staff, including myself, we are in several days a week and at home several days. Part of our biggest numbers that we've seen, because we are an agency that provides traditional community services as a mission, we've seen a 276% increase in households looking for food. We went from what we thought was a high in 2019 of 162 families in a 1-month period to 609 families. So we're talking about feeding between 4,400 people in a monthly basis in 2019 to over 16,000 people that we have been feeding in the same time period. So one of those reasons for the increase is that our food pantry and our district food pantries, all of the boundary lines are down, so people can go to whichever pantry they so choose. In the early weeks, I think everyone was quite frightened. Obviously, this was a disease that no one really knew much about, except that numbers were increasing, hospitalizations were increasing. And so we began to see people really hunkered down. They weren't really coming for services. Our agency is still open. We are providing all the services that we have provided. We're doing some of them a little bit differently, but obviously, we are in a position, thankfully, in Western New York, where our numbers are, although on the increase, some we believe is due to new testing, but others are that the disease is beginning to take hold in certain areas of the community. Given our programs, we have been very fortunate. Even hate to say it out loud, but we have not had a positive case of COVID within our organization as far as our residential programs are concerned. We have had one staff person test positive. We certainly have others who are in the suspected case, and depending on their doctor and testing availability, we don't know for sure whether or not it's COVID, but obviously everyone's treating it that way because you want to be better safe than sorry. In our residential and our pros programs, people are missing contact. They're missing contact with their friends, with their families. And so in our pros program in particular, we have an artist therapy program that's been very successful over the years. So those individuals decided to create postcards, and they're sending them to their friends and to their family members. And they're also sending them to individuals within the program saying, we miss you and we are waiting for you to come back and we'll be here when you come back. So that's been something that's been a very exciting addition. What's been working well for us and what have been our challenges? It's, as you've heard, both the commissioner and Amanda say, everyone is pulling together, which is really wonderful. We've had an incredible largesse and generosity from the foundations in Western New York. So we, as an organization who provides both residential services and also community essential services, have really seen our foundation stepping up with funding and moving forward in that. It's really sad to think that a pandemic has made us reassess how we do things and how we have to get out of our own way sometimes. But that's been also a very exciting as well as challenging aspect of working in this particular field. As most agencies have talked about, getting up into computers and technology platforms has been really challenging for our organization and for our individuals, our clients, and some of our staff, those of us like me who are a little bit more in the dinosaur era where we used phones more specifically than computers to talk to people. But certainly I managed to get my computer on this morning, and so you're seeing me, so that's an exciting thing. The other side effect of that is the volume of emails. I'm sure all of you are just receiving tons of emails because people that you would have talked with normally, you would walk down the hall and go to their office. Now you're talking to them by email. So that's just uploading your inbox on a daily basis. And one of my friends here in Niagara County talked about how it was really exciting previously where you could have some virtual meetings and then you have some in-person meetings, and so your day was very different. Now you are just strictly, because many people are working from home, you are moving from one virtual meeting to another, and they are back to back to back to back. So we have to sort of find a way in living in this virtual environment to still take that breather in between meetings and take some time to really assess what is happening within the confines of our organizations. PPE obviously was a big issue in the beginning. Our orders kept being taken by either FEMA or the government or something. So finally we are seeing an easing of that, which is being very helpful. With the masks, we certainly appreciate all that OMH and NIAPRS has done to get us PPE, and that's been very helpful. Billing in most cases has been very reasonable, and as Amanda talked about, the telehealth has engaged more people in our agency, individuals who have been reluctant either to come to program and not out of a COVID issue, but they've just been reluctant, or maybe they're having a bad day, but they're willing to talk to you by telephone. So we are seeing an uptick in engagement, and I'm very hopeful that this is something that will be put into the toolkit and incorporated in what we're doing on a regular basis. Also, the bigger challenge as a CEO is trying to keep people connected, making sure that people are feeling valued, making sure that we know where people are and what's happening to them and their families. And when there's so much else swirling around you, sometimes that's something that can get lost very, very clearly. What's it like to lead in COVID environment? I guess if I had to describe it in one word, it would be humbling. You know, with staff's willingness to come in every day, knowing that it puts them at risk, meeting 200 people in a soup kitchen line, being with 200 adults in a residential program, and residential programs in our area is challenging on a regular basis, let alone in an environment where you're concerned that when a person coughs, oh my goodness, do they have COVID? Do I need to do something different? It's really stressing our abilities to be flexible. They also say challenge and change comes out of adversity. And so it will be exciting to see what changes and what new strengths we all seem to rely on and will be able to rely on as we move forward after this particular episode is over. What's different, I think, and what will be needed and better after the virus, I think it has been said by the commissioner, Amanda, Harvey, Len, whoever has been talking at any particular time. We've been screaming for years that one size does not fit all. And if there ever was a time to really think about one size does not fit all, it is this COVID environment. While we're still doing some things the same as a group, we are doing many things differently and many things to engage people far differently than we have done in the past, which seems to be working very well. As far as personal experiences, in my family and my extended family, thankfully, we've only had one person that's been touched by COVID. It's a niece who is in a law firm in New York City. Obviously, she has recovered and is doing well, and we're happy to hear about that. The other detriment, I guess, is my poor little 11-year-old Havanese, Desi. He's happy to have me home, but he has no idea what I'm doing at home as often as I am, because during the normal work week, that's his sleep time. So I'm interrupting sleep time for him. On a non-program note, I guess I just would like to say it breaks my heart that families are not able to mourn the loss of their loved ones the way that they need to and the support that they need to. And I am just incredibly moved by what my colleagues downstate are doing, what you've endured. I'm so very proud to know you and serve with you, and in serving in this mental health field and with our beloved NIAPers. I'd also like to gratefully acknowledge OMH for undertaking so many things in this time frame and really supporting us and offering guidance as quickly as you can and as well as you have been able to do. We've been connected by many of the teleconferences that are held during the week, and it's really been very helpful and challenging. And I guess to all of you out there, I would just like to say thank you for what you do. You are so important to what we do in the mental health field. I hope you all are having as good a day as you can possibly have, and know that you're in our thoughts and prayers on a continual basis. So thank you, Harvey, for the opportunity.
Thank you, Robin, for your ever kindness and leadership and your strength and your words today. I just want to tell you in the chat box, somebody from New York City was giving you back some love and said they're native of NF. I'm not sure what NF is, but living in New York City, they can contest to all the amazing things that Community Mission does. I just wanted to tell a story you told me, which is that I was struck by the amount of face-to-face services you're offering. You're a mission-based, faith-based group, and you haven't let up at all. So you're not, and you may have said this, so I just want to reiterate it, a lot of your work is still face-to-face. It's not as much virtual.
Yes.
You're there where the people are there and where they need you.
Our pros is still running 40 groups a week. So we're just very excited to be able to do that. And, you know, we're still doing telehealth and we're doing other things remotely. And we're also very conscious of trying to give our staff breaks so that all of their work is not face-to-face, and they do have some downtime where they're not face-to-face. But yes, it's exciting. I am so proud of my organization that we have been able to keep all of our services and be able to continue, because I think there's certainly, I'm not knocking anyone that's gone remote, but there's something about being there and present and being with the people that you work with.
And it should be said that you're the best example of that, because you go to work several times a week rather than staying remote. Do that to set an example and to share support for people. I just want to commend you for that. Okay, we should now move over to Barry Brogan from the North Country. Barry will come on. Hey, Barry. So Barry has kindly agreed to represent so many agencies up in the North Country, and his group, the North Country Behavioral Network, brings them together, and he's a great advocate for them. and he was kind enough to do a search, a scan of what's happening in the North Country, and he'll share that with us right now.
Good. Thank you, Harvey, for inviting me to speak with this honored panel. Commissioner Sullivan, Amanda, Robin, thank you for your comments. And what you're going to hear from the North Country will underscore, underline, reinforce, affirm many of the comments that have been made, particularly by Amanda, about what she has been seeing across the state. And then I think, particularly with regards to children, we have some lessons that we've learned here. Very quickly, the North Country Behavioral Health Care Network is a network of 20 independent behavioral health providers. They have services in 9 North Country counties. So if we think starting in the east of Glens Falls and right up across the Crescent, Plattsburgh, Ogdensburg, Messina, and down over to the Watertown area, including Lewis and Hamilton County in the interior. So 9 counties altogether. Our providers provide substance use disorder, mental health, and social determinative health support services. They include 2 hospitals, 1 federally qualified health center over in Watertown, and the rest being not independent, nonprofit, community-based organizations. So the population here in the North Country, this is a very rural area. We have no major cities. Again, those smaller cities of Plattsburgh, Watertown being our kind of bookends, but then Glens Falls down to the south, and then some smaller cities, Messina and Ogdensburg up in St. Lawrence County. About 550,000 people in those 9 counties. Our population is older. We have a large prison population. We have Fort Drum over in the the Jefferson and Lewis County area, just outside of Watertown. We have a lot of prisons, as I mentioned. And we have a number of second homeowners that are here, particularly in the Adirondack region. And many of them have migrated to the North Country early, and they're here with us. Other things that are creating challenges here in the North Country include over 1,000 people laid off from the healthcare industry. And one of the things I don't think any of us anticipated 6 weeks ago is that small rural hospitals, while the city was seeing the surge and was being nearly overrun by COVID cases here in the North Country and throughout many places in rural New York, the small rural hospitals were laying off their staff. At the same time, they were increasing their bed capacity by 50%, but without the elective surgeries and outpatient services that were then discontinued, their revenue streams dried up, and many healthcare workers, including primary care practices, have had to do layoffs. So it's an irony we couldn't have anticipated, and it's devastating. Our area is vastly rural, so isolation is a constant issue, even in the best of times. About 2 weeks ago, we surveyed our 20 members, and we asked them how their practices have changed as a result of the COVID outbreak. Now, some of the challenges that Amanda talked about and that we're going to mention here have been addressed. And some of those go to workforce training, and I know that NIAPRS is leading the way, along with others, in trying to address workforce issues. We asked about what adaptations they've made to do their jobs, what adaptations their clients, patients, and consumers have also had to make to remain engaged. We asked them flat out, just how's it working? And what challenges what challenges have occurred, and what lessons have been learned. So again, to emphasize what Amanda shared, is that the vast majority of behavioral health services that had been done in person are now being provided through telehealth and telecounseling. and that also includes both just straight telephone conversations, as well as video where that is available. This is not always home-to-home contacts. We quickly discovered that some clients do not have the technology or may not have the connectivity to the internet, reliable connectivity to the internet. And we heard also earlier about limitations in minutes and data that clients are concerned about. So one of the really interesting things that we learned in our survey was that there were a number of organizations that were doing reverse telehealth. So if the client had transportation but did not have connectivity or was not willing to use their cell phone minutes, they could come to the clinic, to the site where they normally would come for care. They would be met with just a skeleton staff that was on board, placed in a private room with the technology, with the laptop computer, and then be able to log on and talk with their counselor, who is actually offsite working from their home. And one of the benefits of that, besides actually having the session commence and happen, was that the counselors are actually being quite a bit more productive as they're able to see more clients in this telehealth environment. So kind of a reverse telehealth where the client is at the clinic and the counselor is working out of home. We've also learned that some clinicians, we have a very diverse workforce, from peers up to physicians, and not everybody on the workforce had connectivity or had technology. So as we've heard earlier, the need to provide technology to our counselors and to clients, patients, consumers, that may be required. So one of the things that North Country Behavioral Healthcare Network did was we, along with many others, pushed out the FCC grant that was available about a week ago. I think it was $200 million. We know that 3 of our agencies applied for those funds on their own, and the network itself assisted 4 agencies in sending in a collaborative application. And those were for iPads, laptops. One was for a large presentation screen for a group home to do remote groups, and then and some was for physical health monitoring equipment. So very diverse application that we submitted on behalf of these 4 agencies. Overall, how's it working? Again, to emphasize what Amanda said, generally speaking, feedback has been very positive, and engagement is up. There's more people showing up. Many clients seem more relaxed and open when engaging via telehealth, and even more so than when they're in person. So that, again, another observation that we're sharing. But there are some areas that have been more challenging than others. These include prescribers are not necessarily comfortable with this, and this may be more over on the SUD side, but I think it applies to MH as well. But the prescribers, they are wanting to have eyes on their patients a little bit more. So there's a learning curve there and a comfort level there that we heard about some concerns. For some staff, and this may be generational, the speed of implementation and the lack of training of going to a telecounseling, telehealth model has been a big adjustment. Things that people felt could have helped is, again, if there was a kind of a ramping up period, there wasn't, but if there could have been, maybe lessons learned for the future, a ramping up period, some role playing between counselor and trainer to kind of work through what a remote session might look like would have been helpful. And then some coaching on the use of appropriate telehealth space. So one of the things that was reported is that sometimes the counselor's space that they pick or that they have available to do the telehealth session may not be appropriate. And there may be background activity going on or too much information available via, what's over your shoulder. I don't know, but that no specifics were cited, but just appropriate telehealth space in their homes. Then lack of time. Well, we talked about the training and technology and the ramp up. Clients also can have a lot going on in their homes. And so one of the challenges reported early on were that it was difficult to avoid the distractions that are the natural part of everyday activity in someone's home, particularly if there are children in the home as well. The biggest, probably the biggest message we got were from our agencies that do have youth children programs and family programs, that children are different than adults, and that their experience, the experience that they bring into a telehealth environment and their ability to engage is very, very different than adults. So one of the things on the positive side is a real comfort level with screens and working with screens and being comfortable interacting through screens. But the attention span is a challenge. One of the things, there are a number of issues here. First of all, children with special needs are seeing a number of case managers, care managers, counselors, school officials, their own school curriculum that they're trying to engage in at home. And so one of the things that we've heard from parents is that enough. The child is being asked to attend telehealth, Zoom, meetings, classrooms, et cetera, throughout the day. It's too much. They're being bombarded, and there needs to be a balance with that. And I have some specific, if we have time, I have some specific anecdotes about children and interactions with them that I can share, but we'll make sure we have time for that.
Thank you, Ray. I appreciate it. I really appreciate your contribution. I got to get Diana in here, but I want to, while I'm doing that, I'm just going to read a couple quick things because I think she's going to wind up running out appropriately the clock. So just some comments. Commissioner, you've been asked about, we won't do it today. We can bookmark it, the level of collaboration between OMH and OASIS and other agencies around serving people with both mental health substance use. The role of BHCCs during this time as a way to coordinate COVID communication. Will OMH pay hazard pay, or how can we get hazard pay? Chaka was mentioning self-directed care in North Country. Barry and I have talked about that actually, or Peter Trout. And Ruth was saying that we're going to be doing some trainings combining self-directed care, psychiatric advanced directives, and RAP. It's very exciting. There were some questions about families. Families are having trouble accessing resources. Some are scared. They need extra support. What about family video chat? Something we didn't get, maybe we can squeeze it in here. How do people do groups, face-to-face groups within the current sort of guidelines? But if we don't get to any of those, I want to make sure we get to Diana Lang from Baltic Street in Brooklyn, and please take it away. Where we've taken some of your time, so I want to you have the rest of it.
All right, thank you, Harvey. Thank you for having me in NIAPRIS and this important information that we're all sharing. I'm Diana Lang from Baltic Street AEH. We're located in New York City. And again, in interest of time, I'm just gonna go over some of the things that Baltic Street has done, which is it's a peer-run agency. And currently, as of March 13th, we went 100%. I coined the term telepeer services throughout New York City. And it's been really an amazing and invigorating challenge and experience in order to provide these services via telehealth. So a couple of things that I wanted to mention was we do have, during this time, our number one concern was making sure that staff had adequate equipment. So myself and another one of the managers actually hand delivered equipment to our staff so that way they could continue communications with their participants, both cell phones and laptops, in order to provide services the following week. One of the things that we've been doing with our resource and wellness center, which is located in Brooklyn, is they were one of the first to kick off support groups via Facebook. So again, if you guys have an opportunity, please visit the Facebook page. It's the Baltic Street Community Resource and Wellness Center. Currently, they've created a warm line. So individuals that are going through crises, if they feel that they can't get through other warm lines, they could definitely connect with us and they can get, a person online ready to speak with them. That's been very successful. The virtual groups that they offer, of course, is the support around COVID education. There is resources group actually with HRA funeral assistance. As you all know that New York City really got hit really intensely with the COVID. And a lot of participants are actually looking for resources in order to help bury their loved ones. So we've been able to provide those type of services for them. Of course, there's yoga for mental health. Recovery dialogues are constantly being spoken of. There's domestic violence groups. There is a food journaling group, and we also have how sleep impacts your mental health. How has the staff and clients responded to us going telepeer service wide? I want to say actually we've gotten such really great responses. We've actually seen our clients really engage during this time. We're really reaching out to individuals. Again, if we try our best, anywhere between 2 to 3 times to try to reach out individuals on a weekly basis. Currently, I know that while we were looking at the numbers, that the first 6 weeks of experiencing this, our telephone contacts have risen close to 800. So we're constantly speaking to individuals on a broader spectrum as well. Facebook has actually connected us with a much larger group of individuals that are seeking these type of services. So it's really been a great experience to try to reach to these individuals. Harvey also asked us what were some of the challenges, including the PPEs and the morale. One of the things that we immediately implemented was to actually implement Zoom. We have weekly Zoom conferences with our line staff. We are definitely checking in on them, making sure that they are okay, because of course, we want to make sure that our staff is healthy and that they too are, knowing that they can come to us and vent. These are definitely trying times. And especially that being in this helping peer profession, that we're also providing these services to individuals that we ourselves may be experiencing at the same time. So we're supporting one another and supporting the staff so that way we can then exude the support onto the community. Our director and CEO of our agency, Isaac Brown, actually procured over 50,000 3-ply face masks. And he was adamant about making sure that our staff and clients were safe. It was very important to him. We were able to provide these face masks to the adult home service, the adult home initiative that we provide services for, to some of the psych hospitals that we also provide services for. And, we're continuously on to connect with the veterans and those that are currently incarcerated, as well as we did a pep rally, a via Zoom pep rally for the staff. Our Adult Home Initiative program reached out to the staff. And of course, we understand that things have been difficult. The way we work has been shifted from face to face to virtual. So we've actually had trivia, and it was a fun game. They got to win prizes and wonderful things like that in order to keep the staff engaged and keep morale up. So what is it like leading an agency during this time? I want to say that it has definitely proven to us that we are more resilient than we are, than we believe. My team is absolutely phenomenal. I have a great executive team that really pushed and kickstart, you know, the movement of all of us supporting one another and supporting everyone that is in this new realm of, you know, conference calls and Zoom, which is now, this is like our new norm. And so we're constantly keeping communications with one another and continue to make sure that we, you know, send that message of true leadership all the way down to the people that we serve. As far as my personal experience with COVID, I want to say that personally, I've known 28 individuals that are that were unfortunately passed from COVID. 2 of those individuals were from my family directly. So, and again, you know, we have clients that that we worked with for a long period of time that unfortunately lost their lives to this disease, and family members that have been affected, you know, and of course our hearts and minds go to them, and anything that we can do in order to continuously provide these supports, we're definitely here for you. And you know, as far as like potential glitches, I want to say that, you know, we've been, you know, I think that Isaac has been really preparing us to really have this virtual based peer services. So we've, you know, been gracious to, you know, use these technologies for quite some time now. So it was a bit of an easy transition for us. So.
Thank you, Taina. You know, I was on a webinar phone call from people with Washington State, and they said that Baltic Street was the bomb, and how quickly you turned the switch, and how you had all those services and all over Facebook. I also want to say that if you get a chance on Facebook, folks, the pictures of Isaac Brown in his driveway with his wife, taking those masks and packaging them and getting them picked up to go to the adult homes, state hospitals, will be probably one of the great memories I'll have of this whole time. And Isaac has made it possible for NIAPRS. He's connected us. We were able to buy 10,000 masks that we just got, and we can order more as time goes on.
Harvey, I'm sorry, I just want to also include quickly, because I don't want to leave him out, Oscar Jimenez from Columbia University, who is a researcher. He has been working with us at the Resource and Wellness Center for financial wellness during this COVID crisis. So if anyone is interested in participating in that group, please, by all means, you can contact me at, I'm gonna put it in the chat, my email address, and you know, you guys can get all the information again on the website and on the Facebook page at the Community Resource and Wellness Center.
Thank you so much. And I can see in the chat box, and I feel the same way. There's a lot of love that's coming to you in the face of your loss, Athena. So just, I hope you can feel that.
Thank you so much, guys. I appreciate it.
We have we have 6 minutes. Well, let me just say, is the commissioner still here? Or Amanda?
Yes, whoops.
There you go.
Yes. I had trouble clicking. I'm sorry.
Thank you. So just a quick question. These are a lightning round, and there won't be enough. And we'll probably do a follow-up webinar, folks, just on this, not part of a seminar, just a webinar to continue this conversation about New York response with COVID, and maybe we'll have some of the same speakers back in more time to get into this. But there's a question, Ann, about the level of collaboration with other state agencies like OASIS, as well as recovery communities, in creating a cross mental health substance use plan and meeting the joint sort of challenges.
Yeah, absolutely. Yeah, we've been working very closely. Actually, DOH, OASIS, and OMH have been, and also working with OPW, have been working very closely together throughout the entire crisis. And we're planning very closely with OASIS on a number of grants that we've submitted dollars for FEMA and others in terms of the recovery phase. So a lot of the work that we're going to be doing is going to hopefully be well integrated and proposed, and it's really an opportunity for the agencies to work even closer together. So that's been ongoing, and it's been great. It's been great.
Several times people have asked me, what do you know, and where is OMH out at trying to incentivize or provide hazardous pay for workers that have been on the front line? That's been a topic the governor has supported. I'm not sure if you know more about that.
I really can't say much more about it in the state. It's still being discussed within the state as to how it will affect, state workers. So we don't really know exactly yet.
Yeah, give them my phone number. I'd be happy to be in that.
I'm sure.
So what initiatives are being promoted to address disparities? That's for anybody. But while we have you, Commissioner, I know that I know you have Matt Knutson and that bureau that's working on some of these areas. Can you talk about, and just very quickly, things that either Matt or others are doing to make sure that health disparities are addressed?
Yeah, I think we're continuing to do the work of looking at, first thing you have to do is kind of really map out with the data where these disparities are, and we've been doing that, and Matt, and we've been doing that. The main thing is access to care and understanding the barriers to that access to care. And often they're very complicated and very complex, but I think that one of the things which has been so demonstrated by this terrible outbreak is that the number of lives lost in the minority communities is just so much higher than some of the lives lost in the traditional white Caucasian community. And it's really highlighted the disparities. And I think it's disparities in overall health care as well as mental health care. And I think there's going to be a lot of work done. We're talking with the city about this and others about how to really get the data and then how to work with those communities to improve access to care, understanding of care, understanding of important public health, just health and wellness readiness. All that kind of work has to be done. But I think it's been tragically highlighted in this particular pandemic.
Absolutely. Will that be something that the Centers of Excellence, you have two of them in cultural competence,
Yep.
be Marshall resource?
Yep. Yes. Yeah.
I can say, my department and the Bureau of Cultural Competence has been working closely, getting input directly from folks. And we're working with the Research Institute.
A comment from Robin Kruger back to the person in the chat box saying, how do you run groups given the social distancing requirements? And Robin says, we're able to hold our PROS programs at such a high face-to-face group level as rooms are large, and we're providing more groups with fewer people in the groups themselves. Hope that's helpful. What about the BHCC? And John Javis will kill me if I don't ask this question. Is there a role for BHCCs here in COVID to help with coordinating responses and such?
Oh yeah, I think absolutely. And I also think the crisis outreach that BHCCs have been doing, which is really quite remarkable, and they've been doing it for their clinic populations, is so important. And I think that they've been doing that in spades during this particular, during the outbreak. So the BHCCs are very important. They are very community focused and based, and they have the flexibility to do the kind of work that you need during a pandemic like this. So the BHCCs have been very effective, and we're hoping that the funding, et cetera, for those BHCCs continues and that doesn't get lost in the federal, the federal morass of funding which is going on. We're hopeful that'll continue.
Thank you. If everybody would come back on camera so we can say goodbye to you and thank you for a wonderful presentation. You're people of a great heart. You're doing fabulous work. You've inspired us today. And I'm going to get this thing off my screen for a minute. And we really, I'd like to do a follow-up, and I bet you people here to do just a webinar more and getting into more depth on these, and we'll get back to you about that. Question, Taina, is the Baltic, the Facebook page, what do they do? Go to Baltic Street?
Yes.
AEH?
Yeah, you can actually do a Facebook search and go to the Baltic Street AEH Resource and Wellness Center, and you will see all the services that I just discussed earlier today. They'll have the numbers for the warm lines, the groups, and groups happen midday, afternoon, and some evenings. They've been really, really great at the center. And of course, if you guys would like to also see like any other resources that Baltic Street has to offer, definitely connect with the Baltic Street Inc. Page as well, or the website. And we also have groups that are being virtually throughout the entire agency as well.
Thank you both. And let me just say, all of you, and on the website, the homepage, Ann was talking about on the helpline, there's a lot of talk about meditation. Ruth gets up every day and records or has recorded. You go on our homepage, there's a string of 15 or 5-minute opportunities to meditate. Really encourage people to do that. Again, I want to thank all of our speakers. Really a fabulous job. The right message at the right time by the right people. Thank you so much.
Thank you.
Thanks, Harvey.
Thank you.
Thanks, everybody.
Thank you. Bye-bye.
Lynn or Eileen, what do we do next? I think, yeah, you guys can probably